It's Thursday morning, so what do we do out of the 8:30 news? We spend some time with the experts at Mercy Health. We call this segment, What's Up, Doc? And we end up learning lots of cool things. And as we point out, each and every time, they learn not to volunteer for radio interviews.
Last time we're doing this?
Everybody wins. Who drew the short straw and was forced to talk to us this morning? Well, that would be our new friend, Elizabeth Burke, who's going to tell us a little bit about herself. Elizabeth, good morning.
Good morning.
How are you this morning?
Oh, I'm doing well. How about yourself?
Do we have anything to complain about other than the weather?
Nothing she cares about.
No, honestly. Good day.
Yeah, we don't have anything at all that she would be concerned about, I don't think.
No.
Elizabeth, looking at some stuff about you here, I see a whole bunch of letters after your name. Will you explain to us what they are?
Sure. So CNM means Certified Nurse Midwife. APNM is Advanced Practice Nurse. And MSN is Masters of Science in Nursing.
Okay.
Wow.
That's impressive.
Very impressive. And where did you matriculate to gather all these letters?
So I actually went to school at Marquette University up in Milwaukee.
Mm-hmm.
So with this degree, it's obviously you have to do your 4 years of your bachelor's degree first, and then following that, a 3-year master's program. So generally you have to be a nurse first, and then after that you can get your master's degree and then sit for board exam for midwifery.
Okay, so it's midwifery, not midwifery. That was going to be my next question, because I'm looking at here on this webpage, and I'm like, American midwifery, we need to ask, because I don't know the answer to that.
Were you up at Marquette during the Dwayne Wade era? Not to put an age on you or anything.
No. I actually just graduated in May, so no.
That's okay.
It's all right.
We don't hold that against you at all.
Pride to Marquette.
At what point in your life did you realize, hey, medicine is the thing I want to do?
So I would say when I graduated high school, I knew I wanted to pursue nursing, and I knew I wanted to focus on women's health from about that age. And then my interest for OBGYN really grew in nursing school. So initially I wanted to go right to midwifery school after nursing school. But then life kind of got in the way, kids, marriage, that kind of stuff. So it took about 10 years before I was able to get the midwife status. So I worked as a bedside nurse for 10 years prior to becoming a midwife, and worked in the labor and delivery, mother-baby areas. So all that, which, is the main focus of basically midwifery.
For people who don't know, and that term, when I hear the term midwife, I think to my son when he was small, the topic had come up, and my son said that sounds like something from the Middle Ages. It sounds like back in the Renaissance, the midwives would. Where does it come from? And better yet, for people who aren't sure, what does a midwife do?
And just to interject, if you're unfamiliar, don't be scared. I mean, I'm stupid, but I just found out what a midwife was like 3 years ago. So,
well, how much call in your life has there been for one?
Absolutely zero.
Okay. You're good. Okay. Sorry, Elizabeth. Sorry.
So honestly, this is a very common question we get. There's so many people that do not know what a midwife does and what they are. So certified nurse midwives are licensed healthcare professionals that blend both nursing and midwifery. So the unique thing about nurse midwives is most of us have, like I said before, quite a bit of bedside nursing experience, which allows us to have kind of a unique perspective on patient care. So this perspective is about providing individualized, holistic care to these patients. And we like to educate patients what midwives are, because there's many misconceptions about this profession. So I would say the most common question I get is, oh, so you do home births? Well, myself, we as a Mercy Midwife group do not attend home births, but what makes our group unique is that you can get that similar birth experience of like a home birth type situation, but you are delivered in our state-of-the-art hospital. Devon Bay Hospital, which when you get care there, you have access to the Level 3 Perinatal Center, which includes services like in-house obstetricians, anesthesia, maternal fetal medicine specialists, and a Level 3 NICU. So these services allow us to provide the best care for our moms and babies should these needs arise, with the experience of that more personal, individualized experience of being with a midwife.
So you don't travel to homes for the actual birthing process. Is home visits part of your job? Later on through the child development.
No. So some other type of midwives that might be kind of more in their scope, but for us, we're all clinic and hospital based. So I am based out of the Roscoe location, and our other midwife is based out of the Mulford location. So these patients would come see us at those clinic locations for their prenatal visits and their postpartum care, and then we would deliver them in the hospital. So no, nothing is done at the home.
And does a mother get a midwife, or is there a team of midwives, or how are you assigned to a patient?
So obviously when the patient calls, and if they're saying they want a midwife, there's certain criteria that they have to meet or not meet, I guess you would say. So if a person is what we would consider high risk, they would not be eligible for our services. But if they are considered a low-risk patient, they have the option to see myself or the other midwife, Alicia, or they can kind of bounce between both of us and see both of us, because usually one of us will be available to be at their delivery.
Oh, and by the way, a little digging, thanks to alert listener Mike, who just DM'd me. Midwifery's been around for hundreds of years. As a matter of fact, New York City first required the licensing of midwives in 1716.
Wow.
Yeah.
So,
it's been around for a long time.
Predates the country.
Just recently, probably in the last 20 or 30 years, I feel like they've really kind of reemerged, because there's a lot of data coming out that supports midwifery care, that it actually helps to improve maternal and newborn outcomes, because there's such a big epidemic of maternal deaths in this country. So just having that midwives available in communities is so important.
So you've seen an increase in midwife requests over the last couple of years?
Yeah, I would definitely say so. I know when I started as a nurse, having a midwife was very popular, and I feel like it's just continued to grow since then. So.
And probably a lot of it is word of mouth, too, where women will share what a wonderful experience, how that added to the experience, how it made it better, made it safer, any number of positives you could attach to the experience.
Absolutely. Yeah, I feel like that's so important. And there's so many women, unfortunately, in the community that don't even know that midwifery care is an option for them. So just getting the word out there, everyone telling their friends, is super important, because there's definitely a need for midwives in the area.
Is that not something that being a man, not married, not going through the child process at all? Is that not something that your doctor would talk to you about, usually, about the option of having a midwife?
I mean, I think there's even some doctors that don't really know we exist.
Okay. I was thinking back to my own kids being born. Now, 24 years ago was the most recent one, 28 the most distant one. That topic never came up.
Yeah. I know. One of the other midwives, I loved what she said. I was training with her for a little while, and she said, "We are one of the best kept secrets in Rockford." And I'm like, "But we need to get our names out there, because it's." I mean, I personally had care from our midwife group for my 3 pregnancies, and I had the best experience. I had the best care, and of course, I wasn't a midwife at that point, but I was a nurse. And I just could not have been happier with my experience. So I really urge anyone who's low risk, pregnant, non-pregnant, come see us, because, we do have a lot to offer you.
Yeah, and at the very least, explore the idea of it, especially if this is something new that you hadn't considered before.
Right, exactly.
And how long does and I think I'm going to use this word correctly, the midwifery last? Once the baby's out, are we done? Or do you follow up for days, weeks, months? When do you part ways with your patient?
So really, we never part ways for patients, honestly. So we can see, teenagers up to geriatric patients. So all throughout a woman's lifespan, we can see them, whether it be for contraception needs, anything from cervical cancer screening, annual exams, anything like that. We can see anyone for any issues they're having with their gynecological needs. So it definitely does not start and end with pregnancy. And that's what's so cool about this profession, is we can kind of follow them throughout their life and really build connections with these families.
Well, without taking the topic of midwifery and pregnancy and all that, making it all about women like it always is. What about the guys you've had to deal with? Some of the dads. Some of your skills have had to probably been employed on keeping a dad calm, centered, focused, things like that.
Absolutely, because most of the time it's that man who's generally the support person for the woman. So we've done a lot of training with them to kind of help them be prepared for childbirth, learn how to be that support person, especially with COVID, limiting the amount of, visitors we can have. A lot of dads are that support person. So, yeah, just finding ways to keep them calm, teaching them ways to support their significant other is super important and is a really,
Do you usually put them on ice chip duty? Is that normally what the dad gets assigned? Hey, she's going to want some ice chips. Yeah. That's well within your skill set. Why don't you handle that?
Ice chips, massages, rubbing feet, helping her breathe. Those are all kind of things that we...
No, they can't mess up.
They can't mess up. Yeah, and from personal experience, that's true. You want things assigned to you that are within your skill set, within your wheelhouse to handle. I remember the doctor said, these are ice chips. She'll want some. You give them to her. Is there anything else I can do? Stay out of the way. Yeah, I think I can do all of those things.
And if you're squeamish around blood, we always had like the running joke of the dads who pass out. Just sit down. If that's not your thing, just sit down. Don't be a part of it. We can handle it. We're equipped. But sometimes these dads give us more problems than the moms with passing out and.
Yeah, I can believe that. I have told this story before when our first child was born. It was an emergency C-section, and we went in, and as I went in with her, the anesthesiologist looked at me and goes, "You all right with blood?" I went, yeah, I am. He goes, because if you're not, you need to say so right now, because I will tell you something. If you pass out and fall on the floor, we're leaving you there because we're dealing with her. Do you understand? I'm like, yes, sir. I promise I'll be good. But later on afterwards, he said, I'm sorry I was so harsh about that, but I've had 4 guys drop this week. So I didn't want to be number 5. And, he did slip me a nice piece of candy on the way out because I did remain on my feet throughout all of it. Elizabeth, for people who are interested in all of this, and you've opened many eyes and ears to this, how do people reach out and make contact with you?
So what they can do is call. They can either call just like the 971-2000, just a general number to call any clinic, and just ask to be connected to a midwife's office, and they'll be connected to either my office or Alicia's office. And then what our patient service representatives will do is ask these women a few questions just to determine if they're a good candidate for midwifery care. And at that point, they can set up an appointment to meet with us. And what's kind of nice about the midwives is we have a little bit more time set aside for these type of visits to really be able to get to know our patients and to connect with them on a deeper level.
That's very cool.
Is really unique about usually midwives, nurse practitioners, feel like we just have a little bit more time, whereas the doctors are just kind of more back to back to back to back, and they're so busy. But that's the nice thing about us, is just we have a little more time with our patients.
I like the sound of that, and I'm sure our patients do as well. We've been spending time talking midwife services with Elizabeth Burke from Mercy Health. Elizabeth, thanks for your time. We hope you have a great rest of your day. We hope you'll come back on with us.
Okay, thank you so much for having me. It was